What has been the interest from the different data scientists that work under you as far as working on COVID data projects?
The Brazil lab has probably done more to just take on COVID head on and trying to track the disease as it spreads around Brazil. And they've done, I would say, it's like an open platform approach where they've created an environment for lots of different companies to come together and share information, several top universities to share intellectual horsepower. And even Amazon has jumped in to share with creating infrastructure to support it. We have even competitors that are partnering together to help track the virus and look for different characteristics that might help for forecasting, for spread, or for supporting things like hospital bed deployment and ventilators and those types of things. Um, that of the four labs, that's the only one I think that has really gone out there full steam to address it. And I think Brazil was a little bit behind the curve in terms of the disease spread, which
Hmm.
gave them some visibility from a global perspective to realize that if they put that kind of approach in place, they'd be able to, it would be effective. In the U.S., we really didn't have that. I mean, it came right on top of us so fast, and
Hmm.
we evaluated the landscape and assessed that our best objective was to focus kind of where the puck was headed, which is more around consumer vulnerability. Who's likely to be most impacted by this? Because the business that they work for is shutting the doors or has shut their doors, and so to give the government and our clients more insight into what kinds of programs or policies they could put in place to help the consumers that are at highest risk. Same on the small business side, looking at who's vulnerable, as well as the CARES Act and who's eligible for CARES
Hmm.
Act help in helping bridge those pieces together, and then thinking about when we do recover, how are those small businesses, who are we likely to focus on in terms of who's recovering the fastest and who's struggling? Is where we get the help for those who are struggling and make sure that the people that are recovering, the businesses that are recovering the fastest, gets the credit that they need to continue to fuel that growth. So it's been very much focused on the businesses and the consumers. The UK lab, uh, what they right out of the gate went to the NHS, which is their Health and Human Services agency that for the UK government, and you've probably heard me speak in the past about the different kinds of models that are used to track a disease, like the susceptibility infection removal model that is often used in the market. Our UK lab is working with the government in the UK to bring a lot of information to that SIR model and improve its forecasting abilities.
Awesome.
So literally, helping hospitals in that fight around figuring out uh, the maximum impact, the number of people that are going to come in seeking critical care condition or critical care attention. We're helping with that in fine tuning and improving the accuracy of those models.
Thank you so much for checking out this clip from the Data Talk podcast. To watch the full episode, you can either go to the Experian blog. The URL is experian.com/datatalk, or you can click on the link, which is found in the description of this video.